improving patient safety and healthcare quality through health information technology. For this, I would like to invite Professor Shuptin Shorbadhikari, Health Information Educationist. A huge round of applause for him, please. He will be moderating this extremely important panel discussion on patient safety. May I invite Dr. D.K. Gupta, Chairman and MD, Felix Hospital, on stage, please. Dr. D.K. Gupta, Chairman and MD, Felix Hospital. Dr. Suresh Bansal, Director, Bansal Global Hospital. Dr. Suresh Bansal, Director, Bansal Global Hospital. Dr. Jyoti Yadav, Director, Kamla Hospital. Dr. Jyoti Yadav. May I invite Dr. Suresh Kumar, Managing Director, Family Healthcare Hospital. Dr. Suresh Kumar, Managing Director, Family Healthcare Hospital. We welcome you, sir. I invite Prashant Vashisht, Group Head IT, QRG Health City. Mr. Prashant Vashisht, Group Head IT, QRG Health City. Can I have a round of applause for all the panelists? And then we'll have the panel discussion. Yeah. So panel discussion on improving patient safety and healthcare quality through health information technology. Over to you, Mr. Professor Shuptan Shorbadhikari, Health Information Educationist. Thank you.
Thank you, Shobik, Ravi, Neha, and all for inviting me here. The topic of the discussion is very interesting, and I think all of you would be getting some take-home messages at the end of this panel discussion. So I won't waste much time because I think we are already running very much late. So I'll start. I'll give each of the panelists a minute or so for the opening statement. Yeah, I'll give each of the panelists an opening statement for a minute or so. And I'll start with Mr. Prashant Vasisht, is the Group Head IT of QRG Health City.
Yeah, hello everyone. I believe today the demand of time is go for digitization, and this digitization can really save patient lives. What we have seen in practical life. If you look at other examples, other countries, they have already adopted this transformation. Why can't we? So this is the time when I think our government, we stakeholders should go ahead and take steps, take all measures required to roll out such massive steps. And even in India, many hospitals have already adopted and using this technology to save patient lives. And the demand of the time is to go for optimization. Demand of the time is to go for various initiatives like how we can bring in clinical excellence, how we can save patient lives, how we can control medication errors. So, but how all these things will happen eventually? This may happen just because of digitization. And digitization starts from our own home. We must understand the need of the time. Thank you.
Thank you, Prashant. Dr. Suresh Kumar is the Managing Director of the Family Healthcare Hospital. Your opening comments, please.
Yeah. Basically, I'm a oncosurgeon. We are dealing in the oncology. We need how much helpful the technology in the patient safety, because if you go through the starting from the investigation up to the treatment, we always require the technology help. Either we are doing the colposcopy, biopsy, FNAC, ultrasound guided, and keeping the record of the patient is very important, and tracing the follow-up. It's very important because when we start the treatment and when we follow the thing during the chemotherapy, surgery and radiotherapy, we require all the records should be impacted and compact on the one card system. Then we will follow the patient properly and we can serve the community better.
Thank you, Dr. Suresh, for your comments. I now invite Dr. D.K. Gupta, Chairman and MD, Felix Hospital, for his opening comments.
Hi, good afternoon. I am Dr. D.K. Gupta. I am chairman of Felix Hospital, Noida. This is one of the fastest growing hospital in North India. And I think the topic is quite interesting and it speaks about 2 points. One is quality and second is safety. And I think there is a high need of IT information technology to assist in both these areas, be it quality of care, means patient experience and patient's value for the money, and second, the safety of patient. So I think we should discuss one by one. Regarding quality of our patient experience, IT is helping out starting from support services like cafeteria management, parking space management, front office billing, patient coordination, queue management, CRM, they are scheduling of appointment. There are so many things that IT is helping in out. And second is quality of treatment. Quality of treatment depends upon what doctors prescribes. It is delivered in the same way, in the same manner to the patient to get the best results out of it. And because doctors, they are not quite good in handwriting and they are not quite good in writing detailed notes, therefore that there is a support from the IT, they should digitalize, as previous speaker has told already, like there is around 23% prescriptions errors in by a normal doctor who goes to the pharmacy. It means by digitalizing the prescription, OPD prescriptions, you can just reduce these medical errors or medication errors in one way. And second, there are so many treatment lines are given in the for the IPD indoor patients, means if there are nursing notes, there are resident notes, there are consultant notes, and then these notes are executed by the nursing department only. And these are also through the IT softwares basically, for the medicine indent, for lab report. If they are working in sync, and they are synchronized, and we are utilizing based of the IT services, then errors in these areas can be minimized to a little level of zero only. And third part, I think that is coming up very promptly, that is artificial intelligence. Now AI is performing in several areas better than clinicians, be it diagnosis of melanomas, be it diagnosis of cataract, be it diagnosis of diabetic retinopathies, and be it diagnosis of even they are able to do provisional diagnosis based on signs and symptoms and past history of a patient. So that is something that is quite promising, and I think we should all focus on converging all these patient care and like patient touch, human touch with this IT technology to give best of patient experience and quality treatment to our patients. There were some friction in the last panel. They were mainly focused on the patient human touch. I think both of this is a need of this time. This is required on this time that we need both IT and human touch both. Thank you.
Thank you, Dr. Gupta. Now I'll hand over to Dr. Suresh Bansal, Director, Bansal Global Hospital, for his opening views.
Thank you very much. I am Dr. Suresh Bansal. I am orthopedic surgeon by profession and I am director of Bansal Global Hospital, North Delhi. Just we have started a new venture. I know clinicians are very busy in their part, and the IT has taken a major role in the health industry. The IT has reduced the cost of the patient by minimizing the extra expenses on other things. By record, we can minimize the cost of the treatment, we can reduce the paperwork, we can increase the administrative efficiency. So IT is playing a big role, and day by day it is going up, and the people who are the technocrat who are doing this job is very helpful for the health industry. Doctors can do their job in clinical side, and the IT people are associating with them, and their role is laudable. And thank you very much.
Thank you, Dr. Bansal. Now, Dr. Jyoti Yadav, Director, Kamala Hospital, your views, please.
Yeah. I'm Dr. Jyoti Yadav, Director of Kamala Hospital. It's a 100-bedded multi-specialty hospital. And I would say, regarding, I think people have talked about the corporate setups, very big institutes who can hire a big IT team, marketing team, everything working at the back end, except for the clinician who are working in the OPDs and really treating the patients. So, as per me, when we say the patient safety, the panel is all about patient safety. So with the use of IT, I don't know much about the IT things. I am still learning on it. starting from the OPD, I think one of the honorable panelists have already told, we can have the triggers on the softwares, like from the lab diagnosis as well as the ultrasound. I get to know in my OPD itself who are the risk patient, high risk patients in the antenatal scenario, and who are like having the anemia or any other triggers in the diagnosis in the lab. So this is, I think, all with the help of the IT only, but still lot much to learn on this platform, and looking forward to learn even more. Thank you so much.
Thank you, Dr. Jyoti. So I think all of the panelists have more or less agreed that IT is certainly needed, and I fully agree that it's not either or, it's both. So brain plus computer is definitely better than brain alone, or computer alone, or technology alone, whichever way you look at it. So one of the ways which has commonly come in all the panelists is, for doing this, you need an electronic medical record or electronic health record system. But then again, the use is not very common. Many of the hospitals are yet to take up the clinical part. There's a hospital information system where probably the billing finance is well coordinated, but not so much on the clinical information. So I'd like to ask the panelists, I mean, what do you think are the barriers or challenges? Maybe you want to start?
See, when you talk about electronic medical record in real-time operations, so it helps in multiple aspects. Someone should understand. Everything cannot be limited to finance or operational, because now, let's say, I'm quoting a smallest example, like medication errors. Medication errors can be minimized easily. Okay, and in India, you know, the medication error rate goes below somewhere around 4 to 5% in many hospitals. It can be easily reduced, number one. Number two, the information access to respective consultants become very easy. For example, if a patient has been diagnosed with some sort of malignancy, and information immediately reach out to respective consultant or referring consultant, it becomes very easy to take action. So the system's role in today's era is to sensitize clinicians, sensitize other stakeholders. When you start this sensitization by passing on abnormality or critical values, or let's say patient got admitted, then you enhance operational excellence, then what happens eventually, you club together each and everything and come up to a solution that eventually helps operations. So this is the answer of your question. And there are multiple instances I can quote you, and I can spend 2 hours on this topic, but the demand of the time is to go both the things parallelly. Definitely without human intervention, nothing is possible, no doubt at all. But when you talk about human intervention, then technology should support, should enable a platform wherein consultant can take right decision at right time. Like right before this presentation, somebody has quoted, retinopathy can be diagnosed. And if you can identify that this patient is going to come under retinopathy, you can save a patient's eye. Permanent eye loss can be prevented. But how it gonna happen? It can happen only when you have sophisticated, integrated solution. But again, there are a number of benefits. But my point is that if we really want to have patient convenience, if we really want to have operational excellence and want to give that wow factor to patients, then I think everything should work together and come up to a solution wherein patient can be benefit. Once patient is benefited, definitely organization gets benefit.
Okay, Dr. Gupta wants to add something.
Yeah, thank you very much. I think whatever we are talking, that is linked with the clinician and the convenience of the clinician, convenience of the patients and our clients basically. And the decision makers are not involved in this. And decision makers means promoters or top management, they are only involved, only interested when they have something linked to their revenue or top line or bottom line. Like Dr. Santanu has already mentioned that we are discussing about the prescription errors. They are 4%, 5% or 10% depending on the setting of the hospital and depending on the set of doctors. But if we have somebody who can speak to the decision makers and tell them that in a single OPD prescriptions, you have 6 leads, that means that patient can be go to for radiology, for pharmacy, lab, for cross consultation, for surgery, maybe for home care, maybe for repeat transactional order for the refilling of the medicines. If we spoke and we have some data linked to these transactions and how we can impact their number of transactions per transaction value, customer engagement activities, and how can we increase lifetime value of our customer or patient. If we have some data on this and that can be presented to private healthcare players, like most of us are middle or medium-sized hospitals, they are not aware for these support services. Because they are not linked to their directly revenue for the OPD also and IPD also. If we tell them, if you adopt these IT systems and they will really help you in developing your top line and bottom line, then definitely it will be easy to implement and it will create awareness among decision makers. Right now we are discussing everything about patient, clinicians and paramedical staff and managerial staff. So I think the voice should go to the decision makers. That's my point.
I think we have been hearing a lot about smart hospitals. Essentially, smart means which is safe not just to the patient, but safe to all, the doctors, the other healthcare personnel. And the other aspect there is green. I mean, it should be ecologically balanced, and of course, that also brings in energy savings, because I think in the morning someone was saying the maximum consumption, your cost goes to air conditioning. So lots of things are associated. Now, if we come back to patient safety, and then I think EMR system, everyone agrees, is the way to go. We need to put it. But when we put data, then data privacy becomes an issue. In fact, right now we have the act in Parliament being debated on this personal data protection. And often some of the hospitals are also storing the data in clouds. So anyone would like to comment on anything, whether data privacy, how would you really maintain the data privacy?
No, I would speak against your point actually. The thing is, when we talk about, again I would say, when we talk about big hospitals and the big cities, so there we have like all the Wi-Fi, everything online going. But when we talk about little periphery in India, so there the things are like altogether different. Where my hospital is, there is always a problem either of the reception staff with the software, there is some problem with the software, the data has been vanished, there is some problem, then they call the IT personnel, because as a nursing home, we have to reduce the cost also. We cannot hire an IT team who is working all the time on the things and the things go so smoothly. So whenever there is a problem either with the discharge, admission or anything, so there occurs a problem of the IT and the cost. So I think this data storing on the cloud you talked about. So that's the problem where there is like little periphery of India we are working, and we cannot work on that thing, I suppose.
Put my point of view, I think, are you working periphery or tier 1 city, tier 2 city, even village area, you can now store data safely on iCloud also. You can purchase a space on iCloud through Amazon, and so many channels are there. Even like if you are working with, there is some insecurity among small and medium-sized hospitals and clinics that they are not really want to share their data with the Practo and something like all these companies, BunMG and like that. Because they think that their data can be misused or that can be exchanged with their competitors, and they can misuse this data for their basically branding or non-branding. But if you have a good tri-party agreement, and these organizations are quite good, they have some repo in their market, and they are bound with some legislative guidelines. Therefore, they have to save your data also. And if you are having something like in-house running your software, then you should have something backup in your in-house also. And in-house, even in extra house backup also, like somebody weekly or daily, they should have some backup. If somebody is stolen your data, if there is something ransom is happening there, if there is fire something happening there, then you will still have your data saved in your computers basically.
Yeah, you want to say something?
I would like to intervene here.
Yeah, please, yeah.
See, firstly, we need to understand the meaning of cloud computing. Okay, cloud computing is nothing but what you are doing is you are just outsourcing your services. whether it's your
Paper
storage.
use, usually it's a pay per use model, so you can.
Exactly. You're outsourcing your services. When you outsource your service, then eventually what happens, you are going to offload your CapEx, your OpEx, right? And giving it to some standard companies like Microsoft, Oracle, or Amazon, right? So in-house, we are not able to protect the data because everything is dependent on one individual. Whatever he is doing is right, or it looks like, okay, everything is right, correct. But there is no standard because nobody is sitting on his head and checking all compliances. But when you have agreement with top notches, then what happens? The top notches are supposed to deliver something which is stipulated in the agreement. So I personally believe that your data is more secured, your services are more secured on cloud rather on-prem setup. This is what I believe as a technology evangelist. I think I would rather promoting on-prem, I would promote cloud computing because this is the era that belongs to cloud, because you can offload your money, your load basically, your capex. That's more important for any organization, for especially hospitals, going through this tough phase. It is really important for us to minimize the budgets. And next thing is redundancy. We always say ki how to secure the data if data gets lost from one location. Then this is the guarantee of your third-party vendor. He is probably securing your data at 7 places. 7 places matters a lot. We cannot afford that, being a hospital. So I think we must understand the meaning of cloud first. Thank you.
Okay, so that's a technological and financial justification. No, that's perfectly all right, but we have a more fundamental question there. I mean, the basic question is, taking from what you said, sharing the data. If I share the patient data, will the quality of healthcare improve? Will the safety of the patient improve or reduce? Any takes on that, anyone?
Yeah. Sharing the data means you are reconfirming that your patient data is safe. Either it is on your in-house system, or if you are outsourcing, that is wonderful way. Even in outsourcing, you can, if you have a large chunk of data, you can have your own space also, and you can manage that space also. And there are something like, if you're giving somebody outsourcing it also, it is also quite like affordable right now. And because I think not in healthcare industry, data is important right on every industry. Not point of view safety also, with their revenue also, with their profit also, with the quality of care also. Like if you have saved data, past history of patient for so many visits, and sometimes he lost all the hard copies with him, and he don't have any MRI or CT film, but still you have stored all his data in your system, and he comes back, and if he is having heart attack and you don't have any past history, and at that moment of time, that data can be life-saving for him, for the patient safety point of view.
Yeah, I think the discussion has become quite stimulating. Whether it has stimulated the audience or not, can we put the lights on there, please? And let us hear from the audience if you have any questions based on the discussions we have had so far. So any questions you would like to ask either to the whole panel or anyone in individual, please put the lights on in the audience side, and I can see a hand going up. Can you please share the mic with the person? Let us make it more interactive.
Yeah.
Please,
I am Dr. S.B.
please
Sinha
identify
from-
yourself, and
Yeah.
you may direct the question to anyone.
Yeah, I am Dr. S.B. Sinha, and I am President of Biomedical Institute of India. What I understand from my tenure in Health Ministry, that there is a legal requirement for keeping the data for 5 years, 7 years, depending upon the requirement. So now, if we are outsourcing the data to the cloud, who is responsible for who is legally responsible? I mean, the outsourced person, or as an administrator, I am responsible. Who is responsible?
Legally, the primary service provider is responsible, but you have a tie-up with your outsourced agency. Therefore, there is around more than 99.9% safety of your data. And for like medical legal cases, you have to store. And now government is also accepting soft copy storage also. Even Supreme Court has given guidelines for soft copy storage. So therefore, they need not to have hard copies. I think most of the time, you lost your hard copies basically. You don't have file for death patient, you don't have for the medical legal patient, and that time you are in crush. And if you have soft copies uploaded on your system or in outsource agency, then it will really help you in that case.
And government has announced that a standard, EHRS standard. Yes. So who will comply to that standard? Because I am not storing it, so do I need
You have to store, well, you have to collect the data, you have to segregate the data, you have to give coding to data, and then in your format, the outsource agency will store it. For that, there are few IT agencies, they can help you, they are HIS, they can help you for ICT coding and everything. There is in-house right now available in the softwares, but this is your primary responsibility, that is not their responsibility.
Thank you.
Okay, I'll answer your questions, both the questions. The first one regarding that, the data protection, the personal data protection bill, as I said, right now it is in the parliament being discussed upon. So there it's given, the controller of data controller, what are the responsibilities when it is stored, what is the responsibilities, and I think they might again put it in the public domain also if there's some further issues to be taken. So once that becomes the law, which is likely to become in this winter session itself, whatever is given in that law will be applicable to any data, including health data. That is as far as the legality is concerned. The other part about the EHR standards, they have been a recommendation. The Ministry of Health and Family Welfare brought out the first edition in August 2013. Yes. Then it was revised in December 2016. But those are recommendations, those are guidelines, not yet legally mandatory. The National Health Policy 2017, the third edition which came out, there it was said that the National Digital Health Authority will be set up. That will actually give the regulations, I mean, whether it is mandatory, if not, how, when. So for that, another bill was framed, the DISHA, the Digital Information Security and Healthcare Act, which currently is not there because this personal data protection law is supposed to cover everything, including healthcare data. So once that becomes a law, it will become clear how it will be applicable to healthcare or whether something more needs to be done. Meanwhile, the National Digital Health Blueprint has come out. So within the National Digital Health Blueprint, which the NITI Aayog and the Ministry of Health and Family Welfare has brought out, there it's written as going to be a National Digital Health Mission, which will give the guidelines, exactly what is to be done, how it is to be done. Now, for the standards, as I said, using it as of date is not yet legally mandatory. But once it becomes mandatory, then that certification part will also come. I mean, who's going to certify whether I am EHR standards compliant or not? So for that STQC, that is the software testing quality certification arm of the Ministry of Electronics and Information Technology, they are developing the protocol. It's almost ready now. So the National Resource Center for EHR Standards, that's in CDAC Pune, has been involved in developing these guidelines. So they are now almost in the final stage once they're notified. So STQC will be the agency which will actually certify whether the EHR systems being used are standards compliant or not. Okay. So any other question, anyone else?
Can I make a point?
Yeah.
I'm Ajit Saxena. I'm a robotic surgeon at Indraprastha Apollo Hospitals in Delhi. And I have a difference of opinion with Mr. Gupta, wherein you have mentioned that artificial intelligence will take over physicians, as I understood.
It will help you. It will help you because we are shortage
Absolutely.
of doctors right now in India and abroad, everywhere. Like whatever is huge doctor-patient ratio, you cannot justify with your patients. You don't have time to see your patient. But if somebody is taking all history and they are recording and they are giving some provisional diagnosis, then it can help in final diagnosis. I have said they will help in provisional diagnosis, not in final diagnosis.
I can tell you there are so many patients who come to our clinics. Professor Gupta from Medanta is also here. There are so many patients who come to us with sheets of internet downloads. And they are the most confused patients.
That is something else. You are talking about, that is something else.
No,
that is not
but
AI.
that's part of IT.
No, that is IT, but this is not AI. AI is based on your, AI is also made by us only, doctors only.
What I would like
only,
to submit,
not this.
what I would like to submit is that this has to be taken with a pinch of salt. You cannot replace the human brain. You cannot say that in 10, 50 cases this was the result and therefore you've got this. Because the first thing that internet says is cancer for any organ.
That is different. I think it is different context.
I think digitalization is good, but only to a certain extent.
Yeah. We'll clarify it. Don't worry.
I think, Dr. Saxena, I will give the answer to you. The IT department cannot replace the doctor. First, you have to be clinically assessed and you have to be informed the IT person which area you want to examine, and what part you want to examine, what is you are suspecting, then he can help you. Either if you write down totally ultrasound whole abdomen, the radiologist will do the whole abdomen ultrasound. He will not look after the thing you wants to see, whether you wants to see the gallbladder stone or you wants to see something else. So we cannot replace the doctor with the IT department totally. You have to keep the record in your mind and in your system also with the other agency.
I think you brought out the point that I wanted to say, that the IT department has to work closely with the clinician. You cannot work in isolation.
Definitely.
Taking this debate, artificial intelligence in coming years will do lot of things which probably even doctors cannot do, like radiologist. There will be millions of reports which the AI will read and give the report better than any radiologist will make it. Pathology reports. Pathologists often make mistakes and they cannot come to the conclusion. What AI will do, they will have millions of images, millions of reports, and then they will see with the taking all the history and everything, and they'll come out with a very accurate diagnosis. Artificial intelligence is helping in many simulation, many procedures and many things. And the way it is going to explode, you will not even imagine what will happen after a few years.
I think you are a robotic surgeon. In robotic surgery also there is a major role of IT. They are helping you. So I'm not, they are replacing you, but they are
Don't deny
helping
that.
you.
No, I'll just summarize it in what is going to be the future state. It's not that artificial intelligence is going to replace doctors. That is never going to happen. But what is certainly, most certainly going to happen is doctors who don't use AI will be replaced by doctors who use AI. That is certainly going to happen. So it's better that all doctors actually embrace AI. Of course, as I said, I mean, AI is not computer alone, it's computer plus brain. There's a lot of domain expertise going in developing these programs. And computer is meant for data crunching. It is an idiot box. It does not do what I want it to do. It only does what I tell it to do. But because it can do an amount of data crunching which the human brain is not capable of. So definitely we can gain more insights, and whether we can use it or not, on that will depend whether we would be there or not. Yes, any other questions from the audience, anyone?
I think
I think there's someone. Can you please put the lights on in the audience, because it's better if you see who's asking the question, and please speak with the mic.
Somebody made a comment, computers can't replace.
I can't see who's speaking, please.
Okay,
Please put the light on and give the mic. Please put the light on the audience and give the mic to the person who's speaking.
I'm Dr. Suren Shukla and I work in healthcare technology space. So somebody was saying technology can't replace human. I think it has already replaced. How many telephone numbers you remember today? Can you give 10 numbers which you used to remember when the mobiles were not there, right? So it has replaced. Technology is coming, right? I was trying to make 2 points. I think when we are deciding, especially for a smaller, is it audible? Smaller hospitals, and how do you take decisions? My experience that people, when you're talking to, they take decisions on what the software can do and how much it costs. I think you have to think differently. You have to have what indicators you want to achieve. What are your concern areas and what you want to hit on? That should be your first target. Second, the system is to reduce cost, one, IT system, because it brings efficiency into the system. Two, the quality of care, that should be the objective. So how it is going to improve the quality of care? There were different examples coming out of this platform since yesterday. When somebody mentioned about the lab results coming, or whatever. So there are many parameters based on which you have to, you can improve the quality. And third is how can you predict your business? That is very important. These are the 3 parameters you should consider while considering an IT system. And fourth point, I think there was a debate, how secure is data? Is your data secured? whatever you do, everything is, I think somebody is looking at that data. Whatever you are doing, any transaction you are doing on your mobile or any system, somebody is looking at it. On the other side, you are transacting your you're doing financial transactions in the bank, it's secured. And I think most secured is the systems on the cloud, because there are specialists who are securing your system. If it's a in-house, somebody you have hired, first thing you cannot incorporate the technology to protect your data inside. It's very, very expensive, very expensive. You cannot have the specialist to secure your data in-house. Two, third, one guy goes, he will take your entire data. Another you replace, he will take your data. So in-house is 100% not secured. Outside, it is 99% secured. Thank you.
Thank you. Coming back to the first part of our panel topic, actually, improving patient safety. So there are multiple ways EHRs can improve the patient safety. The first is, of course, alerts. You can have multiple alerts. Of course, there's a chance of alert fatigue also if there are too many irrelevant alerts. But what sort of alert? It can give, you can flag when there's a possibility of a potential drug-drug interaction, or drug-food interaction, or drug-disease interaction, food-disease interaction. At multiple levels of alerts could be there. And of course, I mean, just because an alert is there, it's not that the technology or the clinical decision support system is dictating the option. The option is always with the human clinician. They can override. But often what happens, we overlook some simple things at the heat of the moment due to some reason or just simply due to hurry. So here at least we'll get a second chance to think, oh, if I do this, then there's a possibility of this sort of thing happening. Should I still do? I may still choose to do it because the pros are better than the cons. So there are lots of things involved. But then using EHR safely again also requires a lot of safety precautions. In fact, there are safer guides for that. If you go to the US site, in fact, Dean Sittig had come to India also in 2014 APAME. Dean Sittig and Hardeep Singh. Mr. Bedi is sitting here. He was also present there. And there are lots of guidelines how to make the systems more safe so that this patient data as well as safety of the patient, and if the safety of the patient is enhanced, then obviously the outcome, the health outcomes are improved. So anyone else, any questions in the audience? Yeah, 2 more questions we'll take, then we'll give the panelists a closing option, closing comments from all the panelists, each of them. Yeah, Shantanu first, and then Mr. Bedi, and then we'll come to the panelists back for their closing comments.
It's just a comment. We were discussing and debating about the data privacy in digital, particularly in small hospital, madam, you were telling. But if you think today's standard of care is physical data, right? You have this like file that is far more unsafe. That it is being stored there, some receptionist is opening, somebody, it is lying in the ward, some other patient will come and see. Good old days we used to do HIV positive, big way in the file. What is so, at least current standards say that will be much better. The physical, and because you have user-based login. No, your receptionist will only see the name and the phone number. You will be able to see the clinical data. And every time somebody log in and they have breached, you will be able to, episode-wise, you will be able to breach. So current standard of care, which is physical, which is far more unsafe, what we have today.
Yes, Mr. Bedi, your question or comment?
Hello. Just a comment, Dr. Sarvadhikari.
Yes.
See, we have been talking about EHR, its importance, its role in quality improvement and all. My one small suggestion, and now National Digital Health Blueprint also has come, and also a talk of setting up a National Digital Health Mission to work on that, and Data Protection Act is already on the making. My request to providers is, once you are installing this health hospital management information and other things, why not you adapt EHR standards? You see, otherwise you will have to undergo another change management. And they are here to stay. This is my suggestion. You see, all hospitals, who are going in for computerization or setting a health management information system, please insist to your vendor, ki are they conforming to those standards? Because otherwise you will have to redo.
Right.
Thanks.
Thank you, Mr. Bedi. So we'll start the closing comments. That's from the other side this time. So Dr. Jyoti, your final
I think
comments.
the take-home message is already very clear and loud. We need to learn the IT.
Same thing I want to say.
Dr. Suresh.
We are owner of smaller hospital, so we have to switch on to IT side. Though we are not very computer friendly, this is the problem with we people being owner of the hospital. But we should hire IT people. This is not very costly, and the system should be IT friendly.
Dr. Gupta.
Thank you. So I think there are so many software service provider, IT service provider. So I will request them that there are multiple products available right now for queue management, for registration, for scheduling of appointment, for CRM, for customer engagement, for IPD, HIS, billing, HRMS. There are different products in IT industries available for a hospital. It's very difficult for a hospital provider, for a medium and small size hospital to tie up with all these products and have integration, API integration with all them. It's really difficult to us. So I will request all of you to have come out with great solution that should have most of the thing in-house, and that should be universal and standardized also as per guidelines.
Yeah, Dr. Suresh Kumar.
I think we are all doctors related to all the time busy with the patients. Whenever who are providing us the information technology services, he should ensure the backup system also. When there is a breakup in this, he should not take the breaking period. He should provide immediately the backup system. You should, whenever you are buying some technology, you should ensure the AMC, CMC and backup system also.
Prashant.
We have talked much about patient safety, cloud computing and other stuff, but we have not focused on the basic limitations of EMR implementation. What comes across? What's the basic root cause of this delay? Because country is delaying actually, honestly. You look at US, you look at UK or other countries, they have gone far ahead of us. So now, time to analyze what went wrong. So now, I think not only clinicians, I think promoters should come up and take solid steps to strengthen the system, and they should convey message to all the consultants and fraternity and operational staff that look, we want to go ahead with this vision, and we want to go ahead with IT savvy approach. And I think this is the time to realize the benefit, not only for patient safety, but other benefits are also there, which are still intangible for most of us. Many benefits are there. We can take the patient care and quality to next level. We can definitely compete with countries like US. But high time to understand and figure out the reasons of these delays. So I think somewhere down the line, technology itself, plays crucial role, because technology is not supporting consultants. Consultant comes up and says that, hey man, your system is not very friendly. So we technology specialists should design a user-friendly system that can eventually help respective stakeholders, especially consultants. Consultants do not have that much time to spend on writing many things, right? So we should club in other technologies as well, like pads are available, writing pads are available. We can offer pads to consultants. We can go for voice recognition system. We can go for voice to text. Okay, many things are available in the market. Ask your vendor or solution provider to club in all the technologies and give us a final solution that can eventually help organization. So I think these are the challenges we must understand. And again, I would request all of you to see the benefits and impact of automation. Thank you very much.
Yeah, I think that's a very good point, value addition, because obviously if someone is entering a data, what is he or she getting in return? That's a very important thing, which is sadly missing from most of the, if not all the health IT implementations anywhere in the world. So that's a problem. So I think this panel was been very interactive, and we have tried to answer a lot of questions, but probably we left you with more questions than answers. And I think if you have more food for thought, go ahead, think over it, apply in it your own life. And I think I thank the panelists very much and the organizers once again for allowing us to have this session. Thank you.
Thank you, Professor Shupten Sharvadikari, Health Information Educationist, for wonderfully moderating the session on improving patient safety and healthcare quality through health information technology. And thanks to the audience and delegates who are asking pertinent questions. It actually made the panel discussion quite informative, insightful, and attractive. As you all of you have already summed up the discussion, I just want to add one point, that the apprehensions about AI and robotics and IoT and everything. So when 30, 40 years back, when computer was coming to India, we had many negative apprehensions. We thought about lost job and everything. But in today's reality, computer is it's a reality. So I think, as you are saying that AI, IoT, as you have said, that we have to upgrade ourselves. We should not see AI as an enemy. Rather, we should see AI as an assistive technology. I think that is the way to move forward. Thanks a lot for this.